Kgotsong, dumelang, abusheni, molweni, sanibona. Hi. Hello, my darling. You may know me as Sister Bettina from Soul City, but today I'm here as a friend. As Sister Bettina, I learned to respect health providers a lot. Now I want you to be the best health providers you can be. I'm working with the Western Province Blood Transfusion Service and the South African National Blood Service to tell you everything that you need to know about giving blood to your patient. From diagnosis to ordering the right product and to administering the product effectively. Hi, Dr. Greg.
Hello.
Yes, this is Dr. Greg Belez, head of the Western Province Blood Transfusion Service, which covers the whole of the Western Cape. Dr. Greg, tell me, what are your biggest problems in the blood service concerning clinicians?
Fortunately, not that many. The blood transfusion services in South Africa are ranked amongst the best in the world. But we do have some problems. Many of these occur in the ward and can put patients at risk or cost unnecessary time and money. Up to 5 to 10% of blood requests are incorrect in some way, and what we want to do is minimize those. Many of the problems arise from human error because people are so busy in the hospital wards these days, especially in these times of attempting to cut costs and work as hard and efficiently as possible. Also, occasionally people take shortcuts. And at times when they are very used to doing the same thing over and over, the tendency to make an error or do things routinely can result in problems. We're making this video because we know that clinicians don't always understand the policies and procedures for ordering and administering blood, and we want to make the whole process as safe as possible.
Dr. Greg, what's the first thing you do to give patients blood?
Well, the first thing that needs to be certain is that the doctor is giving the right product, and the clinicians usually make that decision. Each of the blood products, and there are many different ones, are used for different things. We have a lot on offer. Let's go and have a look. Broadly speaking, blood components fall into 3 main categories. The first are the red cell products. I'll show you some. So these are 2 units of red cell concentrate. This really is given to patients who may have lost blood or be severely anemic. And really the purpose of giving these is to give the patient red cells which contain hemoglobin, and hemoglobin is the substance that transports oxygen around in our bodies. Then we move on to the next line of products, which is platelets. Right, this is our platelet storage room. The temperature in here is set at between 20 and 24 degrees. And platelets can be stored at this temperature for up to 5 days. They're stored on a shaker like this, and that's to prevent them clumping. Now, platelets are given to patients who either don't have enough platelets of their own, or their own platelets aren't working properly, and platelets are very important for part of the coagulation of blood. Okay, let's put this back on the shaker, and let's go and have a look at some frozen plasma. Sure. Plasma is stored frozen in this freezer at minus 18 degrees. Plasma is really given for people who have clotting factor deficiencies, so it has a lot of what are called the clotting factors, which are essentially protein molecules that assist with blood clotting, and it also contains large amounts of albumin.
Doctor, out of all these products that you've shown me, how does the doctor know what to prescribe?
Yeah, it can be quite confusing at times. The blood services have published a booklet called the Clinical Guidelines for the Use of Blood Products in South Africa, and this is updated every few years. For all of you out there, the clinical guidelines have all the information you require. It's also available on both services' websites, and there are clinicians from both services available 24 hours a day for advice.
Use the booklet, people, and visit the website. It's got everything that you need. I'm in the hematology ward in Groote Hospital, and with me here is a Dr. Neo from the South African National Blood Service and Sister Charles, and our lovely patient here, Florida. Unjani sis, okay? Ntombi.
Florida, can I tell them what's wrong with you?
Yes.
Okay. Florida has aplastic anemia. Her hemoglobin is 6, which is very low, so I have ordered 2 units of red cells for her for transfusion. Florida, we are going to take you through the process of consent, which means you have to give us permission and to indicate that you understand the procedure that we are going to do on you. As I explained, your hemoglobin is low, so we need to boost your blood. We need to give you 2 units of red cells.
Okay.
Do you understand?
Yes.
So you have to understand that all the units that we transfuse, we test them, so they go through a process, so they are safe for you to receive.
It's okay.
Do you have any questions for me, Florida? Anything that you didn't understand?
No, I've got no question.
Are you sure?
Yes.
Should I go through it in another language?
It's okay.
You sure you understand? Okay.
Dr. Neo, is it not too much to be doing this with every patient?
We are very busy, but it has to be done. Each and every patient has to go through the right processes, and informed consent is one of them. Busy or not, it must be done.
Does the patient understand? Do they ever say no? I mean, you know best.
If a patient says no, we have to still explain to them the importance of taking the procedure and giving consent. But if they don't want to, we cannot force them. We have to make sure that they are in a state of mind where they understand what is being said to them and they agree without any pressure.
What if the patient is unconscious?
If it's an adult or a parent that is unconscious, then we have the head clinician that will make that decision. But if it's a child, then the parent of the child is actually allowed to give that type of consent. Here at Groote, we record consent on a specific form, and other hospitals might have their own forms and procedures, but however it's recorded, we have to have consent. This is your name, the date, and you agreed to this.
Yes.
Will you sign for me? And sister is the witness that you have allowed us to transfuse you.
Dr. Craig, we know what blood product the patient needs, and we know how much is required. Also, we have the patient's consent. How is all this communicated to the blood bank?
Lilian, we only need 2 things from the bedside. The first is the cross-match request form, and we need a blood sample. So what Sister Charles is going to do now is take a blood sample.
Florida, I'm just going to take some blood from you. Sorry. And there's your blood coming. I'm just going to put stickers on your blood sample. Just tell me what's your name again.
Florida Zungu,
Your date of birth.
1959.
It is very important to identify the patient correctly and to put the right sticker on the correct blood sample.
Sister Charles is absolutely correct. The biggest single problem we face is giving the incorrect blood component to a patient. And that problem is often caused by incorrect labeling of the sample or incorrect labeling of the cross-match request form. At times we are presented with forms where there are two different names on the same form, or the sample has a different name from that on the form. And at the blood bank, it's impossible for us to tell whether the sample is right or whether the name on the form is correct. Giving the incorrect blood product to the patient can be fatal.
The clinicians know what to do. And then why don't they do that? Is it because they are not so well trained?
No, I think in general our people are well trained in South Africa, and in fact this problem occurs throughout the world. People have a lot of work on their plate. They look to cut corners, they look for shortcuts, and also people doing the same task again and again and again sometimes don't focus as much as they need to.
Sister Charles, what do you do to minimize identity mistakes?
The correct way to minimize mistakes is to check and to check. We will check the patient's ID band. We will ask the patient what is her name. We will check the patient's date of birth to be 100% sure that it's the correct sample that is going down with the correct form.
The form is crucial. Let's take a look at it and let's explain as we fill in why the various parts are important. First thing we need to do is label the form with the patient's details. We put in the hospital name because sometimes the hospital in which the patient is being treated doesn't have the same blood bank. Then we put the ward and that they know where to deliver the blood, but it also enables us in the blood bank to know which ward to call if we require further information or sample. In the private sector, one usually has to fill in medical aid name, medical aid number. Very important details for the blood bank are putting in the clinical information. The primary diagnosis, Florida has aplastic anemia. The hemoglobin level was 6, so that's very important that the blood bank knows that. She's not actively bleeding. That's also important for the blood bank to know that, because that means we don't have to treat the sample with desperate urgency. Then the past history is also important. Very often people get irritated because they think this information is unnecessary, but there's a reason for asking any one of these questions here. Then we put in the details of the requesting doctor and signature. Who took the specimen? The sample was taken on the 13th of June. We also put the time because that enables us to know to the nearest hour how old the sample is. And then we put a contact number for a doctor, and that also enables the blood bank, should they wish to contact the doctor easily without having to really struggle to track them down. The next section is usually pretty well filled in. This is where you request what products you require. So for Florida, we require 2 units of red cell concentrate. They're not urgently required, so we're going to request them for tomorrow at 8 a.m. If your blood product request forms do include the section for the filling in of audit data, we'd really appreciate it if you filled it in, because it can be incredibly helpful for research. Now, one of the really important reasons for making this video is to stress to all clinicians the importance of filling in the form. If it's done well, it really makes our job much easier, and ultimately it's safer for the patient.
This is Karen, the blood bank manageress.
Hi Lilian, welcome to the blood bank. We are just going to tell you as clinicians how the blood bank works, and we hope that this afternoon's operations will inform you as to how we can provide a better service to your patients. So let's have a look at the form that has arrived from E5 ward. The patient sample and the form forms an important bridge between the patient at the bedside and us in the laboratory. And one of the things that we have to look and make sure that the form has been filled in correctly, all sections of the form, and that no patient information is missing.
So how do things go wrong, Karen?
Things can go horribly wrong, and when they go wrong, they can have serious consequences for a patient. If we look at this form, we'll notice that the sticker on top has different information to the one at the bottom. So these are two totally different patients, and that begs the question, whose sample is this really? Who does it belong to? In these instances, we'll write discard across. This form and sample will be discarded. It means going back to the patient's bedside, drawing a new sample, filling in the forms correctly, labeling the sample correctly, and then resending it back to us. A normal cross-match takes about 40 minutes. So if we have an incorrectly labeled sample, it could mean up to 5 hours before a patient gets the blood back.
If clinicians know what to do, why do things go wrong?
Things I would assume go wrong, Lilian, because they are extremely busy. They probably are short-staffed. And because they think that they know the patient so well, they don't have to record all the details. However, our philosophy is if you stick to standard procedure, then you will minimize risk and you will minimize the risk of things going wrong.
What do you do when the names don't match?
Depending on the urgency of the sample, if it is a simple clerical error, we will ask the doctors or clinicians to come down to the blood bank and simply fix up the error. If it is an extremely urgent case, we will give them the option of using emergency blood. If, however, we cannot use the sample at all, we will discard the sample, we'll ask them to take a new sample, and they will have to go back to the bedside again, start all over again, identify the patient correctly, relabel the sample, redo a new form, and send it down to the blood bank. So, from a blood bank perspective, it is vitally important that you fill out the form legibly and correctly, and that you label the sample tubes correctly as well. Lilian, once we have ensured that all details on the sample tube and the request form matches exactly, we move over to our registration process, which is happening behind us here. The registration process ensures that if a sample that we have currently matches that on our database, we can then plan our cross-match procedure. We also can then see if the patient has antibodies. If a patient has antibodies, it's going to take longer than the standard 40 minutes to do a cross-match. Depending on the urgency and depending on how fast we can cross-match, we do ask clinicians to be patient, and we will try our utmost to find compatible blood for the patient.
So Karen, how do you match the blood that you draw from the patient with the blood that you are going to give?
We call that a cross-match procedure, and if you'll follow me, then we will show you how we do it. Because this patient already exists on our database, we know what the blood group is, so the technologist could go into our cold room, select 2 units of packed cells as has been requested by the clinician. We will now move over to the cross-match area, to the auto-view, where we will do the compatibility testing. This is our auto-view analyzer. It is a fully automated testing platform that we use. What Taryn over here will be doing is the sample that Estelle has prepared with the units, she will be placing it on the auto-view, and we will group the patient sample again. We will cross-match the units, and we will also be doing an antibody screen to see if the patient has any irregular antibodies.
What kind of people have antibodies?
Most of our patients have antibodies. The more regularly a patient is transfused, previous pregnancies, and sometimes there are substances in nature which can cause patients to develop antibodies. And once a patient has antibodies, it's going to take so much longer. It all comes back to the form. If we know all the information, we can get the blood out to the patient so much quicker.
Karen, what about emergencies?
Okay, in an emergency case, we can do a stat cross-match, and it takes us approximately 20 to 25 minutes. And in real emergencies, if the doctors cannot wait for a cross-match, we can use or issue emergency blood. And each and every hospital, each and every blood bank has got an emergency fridge. And in it we have group O, RH positive or RH negative. In some clinical situations, doctors anticipate that they won't need blood in a clinical procedure, so they have an option of ordering what we call a group and screen. This means that we will only group the patient, find out if there are clinical antibodies, but we will not be cross-matching any blood. This is a cheaper option, especially in the state hospitals, but it takes the same time as it would do when we would do a cross-match procedure. Lilian, I hope that this has been an informative day with us, and I'm sure after all this blood talk, you would like some real juice to drink.
That's so right, Karen.
Good morning, Sister Charles. Hi.
I'm here to come and fetch blood from E5 from Mrs. Song.
Lilian,
Yes.
so we're going to issue this blood now. We will check for exactly the same details as when we receive a sample. So we will look to see that the surname, the first name, the folder number matches exactly, and we will check the second copy once more. And once we're satisfied that the sticker that she's handed us is exactly that of the patient that we're going to hand over to her, we will then collect the blood from our fridges.
Is she now going to carry it like this?
Definitely not. All dead cells must be stored in our fridges between 2 degrees and 6 degrees Celsius. So all red cells, be it in wards in the hospital or to any outside hospital, will be transported in a hamper. We call this a blood hamper. This aspect will ensure that the blood will be kept cold, provided that ward staff keep the lids closed shut, like this. The person issuing the blood is not necessarily the same person who cross-matched the blood. So therefore, as blood bank technologists, we go and we do the same rigorous checking again. We will check both the units against the form and the patient sticker that was brought. We will check that second copy of the form again. We also check to see that the blood groups match. We look to see that the unit numbers match, that the units have not expired, that the seals have not been opened. And then we also go over to our computer system. It is checked out on the computer, and then an issue document is issued when all the checks have been done. All the patient's details will appear on this form as well. So this is just the copy that they will get in the ward so that they can verify that the units of blood that we've given them is intended for the patient that it's going to. When I issue this hamper out to Sister Charles, she's going to know exactly who this blood is going to go to. So I'll write that it's intended for ward E5. All the patient's details are on the label. I will place this on top. So if Sister Charles meets somebody in the passage and she puts the hamper down by mistake and she needs to pick it up again, she will know exactly what the patient's blood is for in this hamper. So we tie it in, and they only will cut each unit out as they need it. We close it securely, and we will now ask Sister Charles just to sign for the units. Thank you so much for your patience, for waiting here, Sister. And can you just please pretend to sign everything? And Lilian, just one more thing I have to add. Sometimes ward staff get so angry with us because we insist on proper patient identification. But so often we also have patients with the same or similar sounding surnames, like for instance Smith and Smith. And can you imagine how disastrous it would be if we hand over patient Smith's blood and it goes into patient Smith's?
Wow, disaster. Thank you very much, Karen.
Pleasure.
Hi, I'm Mike Leonard and I'm from the South African National Blood Service. We are here at the Ellen Joseph Hospital Blood Bank in Johannesburg. The reason why I'm talking to you from the South African National Blood Service today is that the Western Province Blood Transfusion Service covers the Western Cape, and the South African National Blood Service covers the rest of the country. A lot of our processes are the same, but there is one big difference which I need to talk to you about today. Most of the processes in terms of clinicians requesting blood are similar to that of Western Province. The filling in of the form by the clinician, the receiving of the sample in our blood bank, the capturing on our lab information system. We, of course, have our own forms, but the processes are essentially the same. Okay, so the difference between the way in which we issue blood at the South African National Blood Service compared to the Western Province Blood Transfusion Service is that the blood is also placed into a hamper, but once the blood has left the blood bank, it cannot be returned to the blood bank for patient reuse. First, I'm going to show you the normal way in which we issue blood, and that is where blood is issued, but it cannot be returned to the blood bank. This is our hamper. It still requires a eutectic to ensure that the cold chain is maintained. We do the necessary checks on the blood pack and on the donor request form to ensure that the blood is the correct patient. The blood is placed into the hamper. The hamper is sealed. Cable ties are used to further seal to ensure that the blood has not been compromised. We do have a system called blood on a returnable basis. When a doctor orders blood on a returnable basis, an indicator is placed on the inside of the hamper, and this indicator is to ensure that the temperature is maintained inside. An indicator is also placed on the blood pack, right? And this indicator is to ensure that the temperature is maintained on the surface of the blood pack. So then the blood is placed into the hamper in pretty much the same way. The hamper is sealed. The doctor then has the option, should he not use the blood, to return that blood within a 12-hour period. We will then do the necessary checks to ensure that the blood has not been compromised, and that blood will then be placed back into stock for patient reuse. There is an additional fee for blood on a returnable basis, but should the blood be returned, we do not charge for the actual blood product, but we do charge a cross-match fee. And essentially, that is the difference between the issuing in which Karen described earlier on and the issuing that we do at the South African National Blood Service.
My dear, can you tell me what is your name and surname?
She's Florida. Have you forgotten so quickly?
No, Lilian, but we must check. The day that I don't check is the day that I can make a mistake.
But surely if it comes from the blood bank, it must be correct. If it's not, is there a problem?
When the product comes to me, I'm responsible for that product. So I must check that I give the patient the right product.
And finally, the patient is getting her blood.
Before we commence a blood transfusion, we must have baseline observations. So if anything goes wrong during the transfusion, then we can check on our vital signs. What was the baseline vital signs? I'm going to do the patient's temperature, the patient's blood pressure. Okay, Farida, I'm just going to go get your blood. Okay, this is a unit of blood. So now I'm going to check that there's no leaks in the unit. And I'm also going to check that there's no clots in the bag. Dr. Greg, can you please come and check the blood with me?
Of course I can, yes.
Okay. Okay, as Florida Zungu.
Correct.
For folder numbers 39494810.
Correct.
And it's A positive.
Yes.
The bag number is 103-73766 and expiry date is the 18th of July 2013.
Correct.
And now we're just going to check with the folder.
Okay.
As Florida Zungu.
Correct.
Hospital number 39494810.
Correct.
The reason why we prime the line with normal saline, we don't want any air to go into the patient. Okay, Farida, your drip is up now. So now we're going to commence your blood. Okay. I'm going to open it slowly so that it can run over 3 hours. Now I'm just going to record the blood on the blood transfusion product record. You will put the date and it's the first unit of red blood cells, the serial number of the blood product, the time that the blood started, and the 2 people that checked the blood.
Sister Charles, now that the transfusion is up and the patient is getting treatment, is your work done? Can we go for tea?
No, Lilian, the first 10 to 15 minutes in a transfusion is very crucial.
How do you know if something's going wrong?
That's why it's important that we do the observations of the patients. So what I'm going to do, I'm going to do the patient's blood pressure. I'm going to do the patient's temperature. You just put this under your arm. And then I'm just going to do a respiratory rate. What we also monitor, Florida, is you must tell me if you have any pain by the infusion site. It looks fine to me. Is it okay? Does it feel all right? Okay. No pain in your chest?
No pain.
Are you comfortable?
Yes,
Okay. If you feel funny, if you're feeling sick, then we'll have to stop the transfusion.
What if the patient is unconscious or too sick to answer?
Then we must be very observant. We will do the patient's vital signs again. We will also check for any rashes on the arm, on the neck, and that way we'll be able to see if the patient has any reactions to the blood transfusion.
And what do you do if there's a problem?
Lilian, then we will immediately stop the drip, and then we will treat the symptoms of the patients. We will also inform blood bank, but before we do that, we will check that the patient actually received the right unit of blood. And then we will send the unit of blood with the drip sets to blood bank so that they can check if the problem was on their side.
Please do report all of the reactions to us. It doesn't matter how small the problem might seem. A transfusion reaction is a reaction. It helps us to improve our service and our service to all our patients.
I must say I've got great respect for the medical professionals in this country and for the work that they do. I myself have been a patient and I've received blood transfusions, and I'm grateful that it worked. I'm okay. Hopefully this movie is useful for you, and please don't forget the guideline booklet here. And for any information, you can contact the blood services. And thank you so much. Keep up the good work. Hang it.